Great. So good afternoon, everyone, and welcome to today's Prevention Community of Practice session. My name is Danny Hansen. I'll be your tech producer on Zoom this afternoon. We're so glad that you're here with us for this event, Prevention Social Marketing Made Easy. This session is sponsored and facilitated by Growth Partners, New Hampshire Technical Assistance Center, the Foundation for Healthy Communities, and the New Hampshire Department of Health and Human Services. We appreciate their ongoing support in making these conversations possible. Before we begin, we're going to review a few housekeeping items. Please, to keep the session running smoothly, remain muted unless invited to speak. You're welcome to keep your camera on or off, whatever makes you most comfortable. And remember, if you have trouble hearing us, make sure that you have the right speaker selected, and also if you want to participate, the right microphone so we can hear your participation as well. We're recording today's meeting, so we ask that everyone mute unless you are participating. If you're having internet issues, try turning off your video. That is going to improve the audio. Also, we want to mention we encourage the use of the engagement tools. Use the chat to share thoughts or relevant resources. We have you can also post questions in, and feel free to use the raise hand feature if you'd like to speak, comment. Also, we want to let you know we are recording, so if you want to remain anonymous, please turn off your camera. With that in mind, I want to hand it over to Maura, who will introduce our speakers and get things started.
Okay, thank you so much and welcome everyone. Today, I'm very excited to introduce Elizabeth Duffy. Elizabeth uses she, they pronouns and is a certified health education specialist with focus in substance misuse and overdose prevention. Elizabeth has done work through social norming campaigns, focus groups, statewide social media campaigns, blog posts, community event planning, and digital storytelling. They began their career in 2016 doing underage drinking and underage marijuana prevention in central Massachusetts. Since then, she has worked as a continuum of care facilitator for South Central Public Health Network and held multiple roles in the state of New Hampshire centered around contract management, social media, health marketing, and disease prevention. Today, what we hope participants will learn is how to create a message that lands for your target audience, the important considerations for creating a social media campaign, and how to get your message out there when you don't know where to start. If everyone can please welcome Elizabeth Duffy today. Thank you.
Hi, everyone. Thank you, Maura. Thank you, Danny, Melissa, Candace, and the rest of the NHTech and BDAS team. I'm really excited to be presenting. Can we get next slide, please? All right, so what we're going to be going through today is prevention social marketing made easy. And I'm starting off with some lessons learned because I feel like one of the things that I have come to realize when it comes to this type of thing, it really is a learn as we go type of situation. So one of the first ones that I wanted to bring up was my own first entrance into social marketing when I was working in rural central Massachusetts. And I was working on a sticker shock campaign within a very small town, and their local influencers were a select board, and they did not want to hear from me until I had spoken to the chief of police. I did not know that when I walked in. So sometimes we're going to need to get to our key influencers before we even start our campaign. We're going to need to start the buy-in process and fostering connections before we can really get going. We also need to keep in mind that oftentimes lived experiences are going to be more impactful than fear tactics. So we're inviting in people who have lived what your campaign focuses on, and humans are natural storytellers. That's why we do storytelling. And when we're writing our message, we want to bring those stories in with data as a backup. So this is going to have a bigger impact than some sort of fear-based messaging. And this is also especially good when it comes to materials and testimony for lawmakers. That's something that we'll be going into in COP2 in January, and that is going to be new futures. We'll be focusing on that. And this also does really well in social media campaigns. We see that with social media, people are being more influenced by other people's stories. And last thing that I want to talk about is focus groups. So making sure that our campaigns are going to land prior to rollout, and then actually using some of the feedback that we get through those focus groups before we launch. So thinking that you know the language and word choice for the target audience, but do you? Language changes for different groups of people. Leave editing time. And the example for here is an underage drinking social marketing campaign, also done in central Massachusetts, where we used words and phrases, us as the adults. And then when we focus grouped it with a group of high school students, a lot of them didn't understand the message. So we had to go back to the drawing board essentially for our own messaging campaign prior to launch. Next slide. So another thing that I wanted to bring up was misinformation and disinformation. So misinformation is the unintentional sharing of false information. Disinformation is intentional sharing of false information. And that's finding some sort of article or resource to back up what your own personal claim is, but not having any of the facts and finding something that actually contradicts the facts. So when we are going to combat this misinformation and disinformation, I've seen a lot of the myth versus fact pieces, and this actually accidentally reinforces the myths. A lot of times people are just skimming as they go through. And so when they read the top line and it's the myth, they're only going to focus on that and then continue scrolling. So in order to do that, we need to combat flash with flash. So when we're scrolling on Facebook, we see all of these big claims, these clickbait claims. And that is a tactic by the disinformation crowd, is that they love a loud and probably scary claim. When we're combating disinformation, we want something to be equally eye-catching, just none of the scare tactics, and something that's rooted in fact. And we always want to include sources to back up the correction and promote critical thinking wherever possible. The last thing that I'm going to mention for this is when it comes to using artificial intelligence, is it is a tool and it can be really helpful when we use it well. However, AI does pull from all sources across the internet. And therefore, if somebody who is looking for disinformation can find something on a Google search, an AI bot can find that exact same article, resource, whatever. So really just have a critical eye when it comes to using AI. If you're going to use AI, then make sure you're reading it back through to make sure everything is still accurate. Next slide. And now let's get into the crafting the message, the reason that we're all here. First things first, we need to know our target audience. And this is going to really impact everything that comes for the next few steps. We need to know the who, what, where, how, and we need to know what behaviors they have. What are they looking for right now? What age are they? Their demographic information. Where do they live? And what type of area is it? How are they going to see this message? How do they receive their information? Not on the list, but we also need to have some sort of language, and any sort of cultural impacts could come into play when it comes to crafting a message as well. This is going to help us make a message that lands for our audience. Next slide. Now that we have the target audience, we know where they are, and we know what phrases are going to resonate with them. So we have to keep it clear. We need to make sure that this is going to reflect the values of the target audience. This goes back to the what section of the who, what, where, how matrix on the previous slide. We want it to be eye-catching. We want the bold colors and the pops of color here and there. You'll notice as we go throughout this slide deck that this is something that was intentionally done to make sure that our pieces that we want to stand out are standing out. And this is something that you can take into campaigns as well. To put this in social media terms, we want this to break the scroll when we have people that are going through their nightly doom scrolling. And by keep it clear, we want to avoid acronyms. We want to avoid jargon. You'll see through this slide deck that I tried my best to avoid acronyms. Not every time was I successful, but we want to make sure things are straightforward. And this is also going to help with translation services. Next slide. Let's create the campaign. Everybody's favorite part. We need to be able to evaluate the campaign. So we want to have the plan in place even before we begin creating the campaign. What kind of data are we going to be able to get once this campaign is done? This could be qualitative or quantitative. Qualitative meaning it's narrative, it's word of mouth. It's the verbal feedback that we get from the focus groups and the fill-in sections of the survey. Quantitative measures are more data informed, and they're the numbers like the YRBS. This could also be social media metrics, Facebook, Instagram. I'm not as familiar with TikTok, but I believe they also have data metrics to figure out how many views your posts are getting, how many shares, likes, comments, saves, all of those things. And that's going to be something that you can bring back into the campaign as an evaluation tool. And then also the email blast services such as MailChimp and Constant Contact will have an open rate, delete rate, if it went to spam, if that email address no longer exists, and those kinds of things. And that's other things that you can use as measures. And then also remember that sometimes we might get an estimation. So for instance, if we were to put a PSA in a movie theater, can the movie theater give you an exact amount of people who saw the PSA before the film started? Or is it just going to be estimated based off of ticket sales, but we don't really know who was there in time to see the message or not? And then we have our survey tools, SurveyMonkey, Qualtrics. I'm sure there's a dozen others that I could have listed there. And when you nail that campaign, you contact Service to Science for it to become evidence-based programs, and you have all of the data to back it up. Next slide. All right, we have our message. We have our target audience archetype, and so let's get to creative. Let's choose our marketing methods based off of your target audience. So social media only, or are we adding in print campaigns? Are we doing a PSA? What is the data that we're going to be able to collect from this? And data should be used to enhance storytelling. We brought that up at the beginning of this presentation, but using too many numbers can make some immediately scroll away. One of the things that we've noticed with the invent of TikTok is the attention spans have seemed to gone downhill. And because of that, we want something to be captured to capture the audience's attention, which is one of the reasons why we are promoting storytelling with data as the backup. But wherever we can, we're going to be using our evidence-based strategies and also empowerment statements. And this is a message of hope or empowerment that inspires the viewer to act. It's also called a call to action. So when we end our social media posts, we want to include the, well, what's next? What was the point of this post? What is the point of the campaign? And it tells the viewer what purpose this has. And it could be something like, click to learn how prevention is happening in your community, and we can all make a difference together. I included here something from the YRBS video project that we did last year. This is from the poster that went along with the video itself. And this is a little story about how the YRBS data was used to educate school administrators about the past 30-day misuse of prescription medication in the North Country. So doing so helped North Country RPHN get much needed harm reduction supplies into the school system. Students who reported it was easier to get prescription drugs had 6.8 times greater odds of using prescription pain medicine without a prescription. So we have the story at the top, and then we have the 6.8 times greater odds as our data that is included. But we want to start off with the story and then go into data. Next slide. Best practices. This is my favorite section. with you guys. So just to be honest with you guys, we want everything to be ADA/508 compliance. This is going to be things like readability. If it is a PSA, it's also going to be for those who are hard of hearing, and making sure as many people as possible are going to be able to be impacted by our campaigns. So we have up at the top where it says, yes, that is a high enough contrast. The white on the teal, you can read that clearly. The dark teal on the lighter teal is a no, we can't read that clearly. Somebody who is vision impaired might have a hard time. I'm currently not wearing my glasses and my eyesight is not the best, and even I'm having a hard time reading that there. With acronyms and jargon, we have the Regional Public Health Network spelled out, an acronym, RPHN. We use that in our daily speak here, and it's a habit that we have to be able to break when we're speaking directly to the public. Also, text positioning is important. Left aligned is your friend. It's how our brains naturally read. When we do things in center alignment, it's not naturally how our brain reads, so it has to work a little bit harder in order for it to happen. Next slide. And then reading level. In an ideal world, we want to create all of our materials in a 6th grade reading level. Why? It's easier to translate. It's easier for somebody who didn't finish middle school or high school. It helps folks who speak English as a second language, and it also helps those with learning differences. If we are creating at the 6th grade reading level, it's going to be more accessible for all of our audiences. Next slide. And here's an example of it. And so at the top, we have an advanced reading level. If I had to pinpoint this, I would probably say 11th grade or 12th grade reading level. And it says, our community has strengthened its approach to substance use prevention by implementing evidence-based education, fostering cross-sector partnerships, and promoting harm reduction strategies to support long-term public health outcomes. This is perfect for a state report that just I am reading. If we were to make this more accessible for the public, we're going to say something like, our community is working hard to stop drug and alcohol problems by teaching people, helping each other, and making safer choices together. It's not a perfect 6th grade reading level, but it is closer. Next slide. And we want to have white space. As you can see here, if this was actually filled in, this would probably be very difficult to read. This is a lot going on. This is something that would be overwhelming and probably too much all at once. Next slide. This, on the other hand, would be better for people to read. We would just have one data set there, and there's plenty of white space, and it'll be something so that way people can just focus on the pie chart rather than wondering which one it is that we should be focusing on. Next slide. And when we talk about font and font sizes, the ADA and 508 compliance says that we want our materials to be easily read by people who aren't vision impaired, so no lower than 12-point font. I feel like a lot of times we might squeeze it down to an 11-point if we're trying to hit like a maximum page number, but that wouldn't be something that we would do for a public-facing campaign. And we also want to choose a font that clearly shows the difference between an uppercase I and a lowercase L. So in Aptos, which is considered to be a compliant font, we have I will always love prevention. We can clearly see that the uppercase I and the lowercase L's look different. It's also an evenly spaced wording and evenly spaced lines. Arial, on the other hand, we have the I and the L's looking exactly the same. So that's something that could be a little bit more difficult for somebody who might be vision impaired. And also it makes a difference with some of the screen reader technology. Next slide. Let's talk about language and translation. New Hampshire as a whole reaches the minimum required, the 1%, to need to translate into Spanish. However, I've heard from many of the partners across the state that this isn't always true. So some regions in the New Hampshire area will need to translate to Portuguese. In some places, it's French. In some places, it's Indonesia. And this is one of the reasons why we shoot for 6th grade reading level in our campaigns. It's because it's easier to translate. Next slide. Getting the message out there. All right, one message and multiple avenues. So which platform are you using? And you can drop in the chat which platforms you use for your target audience. I would love to hear about that. So some of our social media platforms like Facebook, Instagram, TikTok, Threads, Snapchat, LinkedIn, YouTube. I'm sure there's more. And even this is demographic dependent. If we were to create a safe storage campaign for elderly people, you're probably not using TikTok. And if we were doing a anti-vaping campaign for teenagers, we definitely would not be using Facebook. And print flyers for community outreach are also very helpful. Email lists, local access TV for some areas, and also Spotify and Pandora ads. But whatever you are choosing here for your channels is we want to have one message, because more than one message is going to be a little bit confusing. And it's best to keep it to one clear, concise message over multiple channels. One of the things that I've heard a lot of times is the one message, multiple avenues piece. And now I'm going to go look in the chat to see what we have. Lots of Facebook and Instagram, couple LinkedIn, camp TVs like that, have X/Twitter, but don't use it much. Nice. I still call it Twitter personally. Next slide. But every once in a while, we're going to need to have multiple messages for multiple avenues, depending on what our audience is. So let's say that we're doing an underage drinking prevention campaign for the whole community before prom season. We might need to have multiple messages in order to hit the liquor store owners, the parents, and also the older friends or older siblings of the youth who are going to high school prom. Let's say that the goal is to raise awareness of social host liability laws and to prevent adults from buying alcohol for teens. So a couple of messages, choosing the cogs here, because you'll see that all of them are working together for the same campaign. It all has the same purpose of preventing the adults from buying alcohol for teens. So for one, we're going to say help teens stay alcohol free. Maybe that's for liquor store owners. And then a drink for them could cost you your future, parents and social host liability. And then hosting, again, with social host liability, hosting isn't helping or keeping them safe. Next slide. And this has to do with macro messaging versus micro messaging. So macro messaging is for a large audience. This is some of the big brands. They use one familiar message designed to resonate with a large audience. So Nike, just do it. McDonald's, I'm loving it. Those kinds of things are going to be macro. For our prevention purposes, we have drive sober or get pulled over. I feel like I see this on a neon sign any given Friday in driving through New Hampshire. Micro messaging gets specific for a smaller audience. This is for our more tailored and targeted message with a specific goal. I have here micro messaging Dover Youth Don't, taken from the Dover Youth to Youth campaign that they did. And I wanted to bring in that local example for you guys. And this is our underage drinking prevention campaign for parents and caregivers. So the macro is the drive sober, get pulled over. It's for everybody across New Hampshire. When we get into the micro, it's talking about prevention for the youth, the parents, and the caregivers. Next slide. Oh, here it is. So macro, we have the whole campaign, whole community. If you look from the top and go down, you'll see that it gets micro, even more micro as we go on. And then another macro one, we're talking to just the parents. Parents who host lose the most. This is a sub-community, and it's still pretty macro because it could be any parent in New Hampshire. In the middle, we have a specific sub-community using the One Voice Youth Project. Micro, getting into Dover Youth Don't, the Dover, New Hampshire, focusing only on that Dover area. If we wanted to get even more micro with that one, we could say Dover High doesn't. So we're just targeting high school, or Dover Middle School or something like that. We can get further and further. I'm sure we could apply this in multiple other areas as well. Next slide. And getting the message out there requires our key influencers. When I started in my own prevention field, we called them key informants, but with the rise of social media influencers, we might as well have influencers of our own. So how can we as prevention professionals use the same system? Think to yourself, who are your local influencers? And you can drop some of your local influencers in the chat for me as well. This could be some of our police, fire, EMS people. This is our faith leaders, our local coalitions, the mayor and select boards, and school personnel. So the principals, the teachers, superintendents, SAPs. I think some places, maybe the parent-student association could be a local influencer. And I'm sure that I have missed plenty with that list. Next slide. Here's some free marketing campaign tools. So I'm going to be also sending this out to all of the attendees so you have it for reference. Because of some of the accessibility tools, there are online font and contrast checkers that you can use. And there's also, I didn't list it here, but there is also a couple of checkers for when it comes to grade level reading and giving you suggestions of how to lower your reading level on your campaign tools as well. So I feel like a lot of us know Canva. It's for the basic version is free and easy to use. There are pre-done templates and stock images and elements. And then the paid option, of course, always has more. Publisher, it's the Microsoft Office Suite design platform. I find it pretty limited, but if you're just doing a flyer or something pretty basic, that's something that you can use as well. Other things that you can use if you have access through your work or school, you can use Adobe Pro as well, PowerPoint, such as this slide deck. And artificial intelligence, yes, I did mention AI in the misinformation section, but like I said in there, it can be a really useful tool for when it comes to wordsmithing your campaigns and creating outlines. Stock images, there are several online stock image sites for free, such as Pixabay and Pexels. Adobe Photos is really great, but it's also not paid. And then, like I said, there are online font and contrast checkers available online, as well as reading level. And I will make sure that reference sheet gets out to you guys as well. And in the chat, we have Microsoft is ending its support of Publisher sometime this year. That is good to know. Thank you, Vicki. Next slide, please. All right. Before we go off into our breakout rooms, I wanted to leave time for a Q&A portion. So if anybody has any questions that they want to throw at me, feel free to. Okay, seeing none. If we can start up those breakout sessions. Speak to importance of font size for mobile versus browser. Yes, I didn't cover this, but that is something that is very important. Your browser, and this is something that I see a lot for website platforms, your mobile view screen is going to look different than the web browser. So we're going to want to check on what things look like on your phone versus on your computer before we publish it, since a lot of times people are probably going to be looking at their phones to view your campaign material. So we want to make sure that the spacing and the font and the font sizes are going to work for phones. A lot of times what I find happens when you look at it on a browser and then you look at it on your phone, the spacing doesn't line up, and then you have to move the screen from side to side, or it just gets completely messed up altogether. But thank you. That's important for us to keep in mind as well.
So thank you, Elizabeth. That was a really wonderful presentation. And we will be sending it out, like she said, to everybody so you have it. And now I believe we're going to go into breakout rooms so you can apply what you just learned from Elizabeth. Everybody has.
Can I answer Heidi's question real quick?
Yes.
Because it just in case people drop off early, because this is actually really important. So I also, coming from the immunization world during the COVID response, there are certain images that are going to be potentially triggering. And this is also important for us to remember as for language as well. So this goes along with the no scare tactics. We don't want to include images that have anything to do with syringes. We don't need to have some of those like old school, this is your brain on drugs kind of imagery, or images with pills all over the place or alcohol bottles all over the place. We want our images that we're choosing for our campaigns to be something that is going to be, again, going into the storytelling and the hope empowerment messaging. So if we're doing a recovery campaign, we're probably not going to be using images of people looking sad and depressed and looking down. We want people to use images of people being out there in the community and fostering messages of hope through imagery. I like in the chat, we love Halloween, but no death images, please, which is exactly correct. We may love Halloween, but unfortunately not everybody loves Halloween. And also that's something that we don't need to potentially trigger somebody. Okay, now let's do breakout rooms this time for real. Thank you.
So we're going to separate you into 4 breakout rooms. You're going to have a facilitator in each of them, and Elizabeth is going to be bouncing around. Everybody's going to have a scenario that will be shared in the room with a set of questions. And we're just going to have a chat. We will need a person to record the conversation and then be willing to share out afterwards. And we're going to develop some of our own messaging from what we just learned from Elizabeth. And I believe we're all going to automatically go into rooms if the sphere works like it's supposed to.
All right, everyone, welcome back. I'm not sure if we have everybody back yet or not.
We still have one room.
Okay.
Close.
Okay, they must still be chatting. That's fine.
Now everyone's back.
Wonderful. Okay, welcome back, guys. So we're going to do a little report out, and I would love to hear what each of you came up with for your 4 scenarios. Let's do the group number 1, the convincing a school administration board for joining to start administering the youth risk behavior surveillance survey.
All right, that's us, I guess. So my group was Candace and Dawn. I'm trying to find Dawn. Dawn Schimberg and Candace Moen. And we came up with data improves student health as our 1 sentence message. And then we talked about local influencers were parents, school counselors, parent advocates, that we would probably recruit some folks from parent-teacher organizations or associations, and students from other Getting to Why programs to come and talk about the importance of using that data. And then the last thing we were asked is, what supporting information would we share with the school board to strengthen our message and convince them to administer the survey? And we talked about that the data is really important to help improve student culture and climate and the overall health and well-being of students, that parents, if they were very concerned, can opt out. We wouldn't lead with that, we had said, but that was an important piece, I think. That the data is anonymous and so not linked to any particular students, and the importance of agency for students, and the opportunity for students to participate in the Getting to Why program. Anything I missed, Candace or Dawn?
Did you mention the just that to address that a lot of parents may say that the information is skewed or kids don't take it seriously, and so then it's faulty information. And I know we talked, Candace had mentioned too, that it's there's filters to protect against that type of
Yeah, that's
being
important.
skewed.
Thanks, Dawn. Yeah. I think that was it.
Awesome. For context of that one, that was based on you have been tasked with going in front of the local school board to convince them to administer the next youth risk behavior surveillance survey. This school has never participated before, but they have a new superintendent who has been open-minded on other topics. And we asked for them to come up with a one-sentence message, who are the local influencers, and then supporting information. And I feel like you guys covered all of that. Thanks, Heidi. And then group 2 was the social norming campaign. You have just received your local youth risk behavior surveillance survey results. And while reviewing the data, you noticed that 75% of high school students haven't had marijuana in the last 30 days. Your youth group has told you everyone is doing it. So this data is not a reflection of the perception of use among youth. You decide that you want to run a social media campaign with your youth group to correct the perception. Could I have somebody from group 2 who wants to tell me about what information you guys decided on?
Yeah, so we decided that we would target high school youth, as those are likely the people with the skewed perception of it. And the slogan that we settled on was "not as popular as you think." So trying to challenge the idea that everybody is doing marijuana, or that kids might feel some peer pressure to do marijuana because they think everybody else is doing it. But you're trying to present them the fact that it's not that popular and that most kids aren't doing it. So we decided that we would run something like that on social media, and that it could even be like a video of kids going and saying that they're a part of the majority that doesn't do it. And then one of the questions was, aside from social media, what would you do? We talked about having a booster table or a public library table, talking about how it's not as popular as you think. And then also that we could make a patch to put on sports uniforms and robotics uniforms and other clubs, so that the clubs could be out promoting that they're also a part of the majority that doesn't do it. And I don't know if anybody else from my group wants to chime in with anything.
Okay, so who in your group is going to run that campaign? Because I also really like the slogan, and I see a couple of people in the chat also really like the slogan. So if anybody is looking to do that, I think you have found at least your bones. Yeah. Thank you, Reagan. I appreciate that. And then group 3 was the vaping education night. Your youth risk behavior surveillance survey results show that vaping has increased in the high school, with 30% of youth have said that they have vaped in the last 30 days. The school you are working with is concerned, and they are wondering what they can do to help bring these numbers down. The principals saw that a different high school hosted a vaping education night geared towards parents and would like to do something similar. Could I have somebody from group 3 who'd like to chat?
Yeah, so I'll share what we talked about. So for the first part, the main message would be aimed at the parents. Join us for our upcoming vaping education night, what parents need to know. And then in the email, we'd include that there has been an increase in vaping. And then also talk about stopping it before it happens. So that way we include all the parents of kids who aren't currently vaping and try to make it more collaborative. Like this is what the school is doing, and then this is what parents can do to help stop it as well. And then if we were talking to youth, we'd also flip the 30% statistic and make it more that 70% don't vape. And then the key influencers would be like the PTA, sports boosters, and parent groups. We'd also talked about getting the health and gym teachers involved and maybe having them offer kids extra credit if they get their parents to come to the night. And then we talked about making sure it was accessible. So like maybe providing childcare from the Honor Society or something, providing a Zoom link so that people can attend virtually and recording it, and then maybe sending out like a small summary in the newsletter afterwards so that all the parents can see.
Thanks, Emily. The only thing I want to add in is just with the extra credit for the youth who get their parents to go or who click into the Zoom link, also having some sort of plan in place or like survey or something so that way the parents who view it later can also get their kids the extra credit. That's the only thing that I would add to that. But I really like that. Okay. One last group. The legislation presentation. You are going in front of state legislators to educate the committee on the impacts of passing a bill that would make the Youth Risk Behavior Surveillance Survey an opt-in survey, which would mean that all parents would need to give active permission before their child participates. You are going to the committee meeting to oppose the bill and use it as an opportunity to educate around the importance of the YRBS and how it informs the work of prevention in the community. Could I have somebody from group 4 who'd like to talk?
So our first kind of question was, you only have 3 minutes to provide testimony for the committee. What topics are you going to highlight? So we started out with, what is the YRBS? So what's the kind of impact that it has? Why is it important? And then going into the difference between opt-in versus opt-out, whereas opt-in kind of, you have to go the extra mile to do something versus opt-out is like if you're kind of in the middle, you don't care either way, you're more likely to take it to give those numbers for good data. And then one of our points for this kind of pitch was also remaining flexible. So listening, not shutting down people who are opposed or people who are pro opting in, and saying if there needs to be change, we're open to change, just not this change. And then this is a little bit of our third prompt, but having the data to back up the opt-in usage rate versus opt-out and showing the disparities between that. And then focusing on how prevention professionals and public health utilizes the youth risky behaviors survey to kind of show that they're working towards healthier youth. And especially for applying for grants and such, it can be really important to prove that the dollars you're using are going towards a cause that makes everyone happy. That's a lot, but we kind of talked about if there are other people giving their testimonies, you can kind of cross out what you don't want to put in because other people have already said it in the time being. And then our key influencers were teachers, administrators, social workers or guidance counselors, prevention professionals, parents and youth, and we also said primary care providers because it can kind of give them a good idea of what to expect when they're going into care for youth in a certain area. And then the data that we would have to back it up would be data from past, like YRBS and how it was used in the prevention space and in the public health space. And then also opt-in versus opt-out, the disparities between the numbers in that data and how more is always better when we're looking at data, really. And then anyone chime in if I missed anything. I know that was a lot.
It was a very comprehensive list. You guys were the group that I ended with, and you guys had quite the list, but I think you nailed it. All right, that is all of our groups. I believe this was the last slide on this. So if there's any further questions, we could also do more questions now.
I had one question. It's a little bit more of an opinion question probably from you,
Go for it.
Elizabeth. So I think a lot of times when we're pushing prevention and education especially, there can be such a wide group of options of our target audience and between like the youth or their parents or school professionals. Is there a certain way that you yourself would recommend kind of boiling that down and choosing the most like impactful one? If you're talking about like youth prevention, for example, you could target the parents, you could target the youth, you could target school professionals. It's kind of like,
Yeah, it really is one of those things. And that's part of the reason why we wanted to do this marketing series is there's a lot that we can do with prevention marketing. So really you have a couple of options here, and maybe the solution is you test your options. So starting off with one, and maybe that is, partnering with Getting to Why and doing more youth information and that kind of thing. Or maybe you want to test with the parents first or school administration. Or there is if you remember the COG slide, you could create messages that all work together for youth prevention and have one that is targeting the youth, one that's targeting the school board, and one that's targeting the parents. So unfortunately, I have no
There's
answer
no-
for you.
yeah, there's no-
It really is. It is kind of a guess and check thing. And I think it also depends on what kind of community you're in and how active the parents are within the school system. Or do a lot of parents work second shift and they're not really going to be able to donate a lot of their time? So
right.
it's going to be one of those you got to feel it out kind of things. And that's kind of the beauty of New Hampshire is we have all types of communities represented.
Very true. Thank you.
You're welcome. Is there anything else?
I guess I kind of have a question, Elizabeth.
Sure.
So I think it's a popular idea to want to test messages with youth and make sure it's resonant and, not cringe, because that would be a sin with that demographic. But do you have any advice or guidance on how you can sort of achieve that while not giving them too much control over the final product and letting it maybe get silly or lose its professional edge?
It really is a fine line. And I think that having the separate facilitator, not somebody who created the campaign, but having a separate facilitator who is there to act as a third party where they have no emotional connection to this product that you just created and you love it and you think it's great, but they are able to act as that person. And maybe this is someone that the youth already respect. So maybe it's somebody within the school system, like the favorite teacher or something, who is able to kind of curb some of that silliness that tends to come with the youth, because we don't want them to have complete free reign, but we do want their input. It's that really fine line. Candace, do you have something to add for it?
Yes. First of all, Elizabeth, great presentation. It was wonderful. The thing that I wanted to add for that, Paul, is there's a campaign called More Good Mornings, and it's through TPCP. I know I'm not allowed to use acronyms, but I cannot think of what it stands for. Tobacco Cessation Prevention, something or other. Another DHHS program. And the way they kind of got around the silliness of focus grouping the kids is they made 5 options for them. And they made, I know this is a lot of work, and we as professionals might not be able to get into this deep, but they had a group working with them. So they gave them 5 options. They gave them suites for each of them. So they were associated with colors. They were associated with images. They each had a theme. And so they workshopped the kids and they asked which one was good for them, which one made the most sense, like which one they preferred. So the kids were able to give a little bit of their input without making the campaign completely silly. So that was one way that really worked super well for that organization. And somebody put the acronym meaning in the chat.
That's a great example. And I saw their presentation where they talked about how they made that one, and they did really do a great job of getting youth input to make sure that it wasn't too millennial cringe and the message would land for them. Melissa?
Elizabeth, great job on your
Thank you.
presentation. One of the things I didn't hear you talk about, maybe you can touch on this, is Facebook influencers. How to become an influencer in your community. Do you have any sort of rule book on how to, is it just repetitive, consistent videos on a particular platform, and then that sort of you gain followers? Is that really like how you do it?
That is one of the strategies for it. So for me, I've mostly used Instagram for building followings. So I haven't had much experience with building a Facebook following. But what I can say, and I feel like this is going to apply across all of the metaverse and maybe even TikTok as well, where if you are consistently posting is going to be one of the key things. The meta algorithm itself wants to make sure that you're not a bot. So this means that you don't want to go out and like spam day after day. Otherwise, that can make it seem like you're a bot. But you also don't want to post 2 times a week and then 5 times the next week and then kind of do this inconsistent, because that's also not going to be good for any of your followers who are looking to you for the information, and they are looking. You have to build the trust, and having that consistent message, that consistent framework, that consistent whatever is going to be what helps you gain that trust within your communities. And that's also going to be, it's going to depend on your wording usage. It's going to depend on what kind of program it is that you're presenting and who your target audience is. But it's also, you gotta have the hashtags, and you don't want to overuse the hashtags, and making sure there's a lot that I feel like we could get into this. This is almost like maybe a part of COP number 3 in the spring, where we get into the now you're off and you're doing it kind of one, where you're really trying to get people into programs. But for the purpose of today, I'll just say that we want to build the trust, we want to build the consistency, and we want to make sure that our message is going to resonate with whoever our target audience is. And metrics are also helpful to point you in the right direction.
If there's no other questions, thank you, Elizabeth, for a wonderful presentation. And Elizabeth alluded to it a couple of times, but I just, before we get into CEUs and things, but this is going to be a marketing series. So this was kind of series number 1, a little kickoff and introduction to social marketing, and starting the conversation about it. And then for our next one, which will be in January, the goal is to have new futures come and really talk about advocacy and how to write a good testimony, how to get the kids involved, how to make the biggest impact as possible when you're talking to legislators, because we know that's a huge impact when it comes to prevention. And then our third COP is still in the works. It's going to be in April. And the goal of that is to really start using the tools that we've talked about today. So how to access things, how to use Canva, how to write a good testimony, like truly practicing these things and really getting comfortable with them is the goal for COP number 3. So that's where we're going. And I will turn it back over to, I believe, Danny to close us out, or yes? Well,
Yeah.
And thank you all for coming.
Thank you, Candice. And thank you all so much for joining us today on this COP on Prevention Social Marketing Made Easy. Appreciate the time and also your participation, the breakout rooms, and the great reporting out that came, and most importantly, all the work you're doing for the community. Before we wrap up, I'm just going to share here our screen. On last time, we have the contact information there for Elizabeth, but we also want to mention our website. Be sure to visit nhtac.org for additional resources, upcoming sessions, and the recording. This recording will be there once available from previous COPs as well. In just a moment, we're going to post this one as well. And finally, please take a moment to complete the evaluation. The link is going to be posted in chat now. And remember, we offer CEUs once you complete the full evaluation to receive this one. You must have attended, which you already hear, but you also have to submit the evaluation. Thanks again for being with us today. We look forward to seeing you in our next COP. Take care. Enjoy the rest of your day.
Thank you very much.